Welcome to the Drilling Millions podcast, presented by Sage Dental Partners.
One thing at a macro scale, what I deal with even in dental school and what many dentists deal with is patient trust. I could tell you numerous occasions where I've been seeing a patient. Actually, one patient comes to the school not because he can't afford care anywhere else, but because he said, at the school at least you have levels above you that are checking your work, and sort of there's no vested interest of you selling me work. And on the other hand, I have a patient who everything I say gets questioned 350 times. So dental trust is a hallmark, I feel, of patient care. So how does Overjet address that?
So what you mentioned around the trust between the provider and the patient is definitely there is a decrease in the trust over time, just because I would say one is decreased, but also like the patients are getting more and more informed about their oral health, or want to be more informed about their health in general. So they want to question. That's just the general population as well. Like generations above us just accepted things that were told, and our generations and others want to question it and why, and want to understand. And the issue here is that people don't understand. They don't even know how many teeth there are in their mouth. If I asked a general person, like, okay, do you have 30 teeth or do you have 32 teeth in your mouth right now, they wouldn't know. So I think that's the level of dental knowledge in the population. And with that, you have first the tools, right, like x-rays, etc., that people are using or dentists are using to communicate, which they don't understand what to how to read them or what those mean. And then you have diseases where they might not hurt, etc., and people associate dentists to pain. So how do you actually communicate periodontal disease, for example? So there's a communication challenge as well. So you can understand why. I wouldn't even say it's like distrust, but why patients are questioning. And I think that's where Overjet can really help, like creating that trust layer first for the patients to understand what is going on in their mouths. They can start to visualize, for example, bone levels in this case, or periapical radiolucencies and other things that the dentist is mentioning. And you can do it with colors, right? Green is okay, red means bad. It's the stuff that patients are used to. So I think that's one that's really helpful. And the second is having this idea of it's not just this one dentist saying it. It is they're using a tool to make a better diagnosis. So they're going out of their way here to do it. Also helps in the patient understanding that, hey, this is not a dentist saying, okay, there's a software also saying it. This must be correct. So I think it actually improves that. The patient provided trust. And we've had examples where the patient went in. So it's very interesting where you go to two different dentists, you might get different opinions as well, which adds to this distrust in a way where, say, a patient comes to you, you diagnose absolutely correctly, and then they go to another dentist and they also diagnose correctly, but the treatment recommendations are slightly different based on how they judge their risk, etc. And now the patient comes back to you and says, hey, Akhil, you were overdiagnosing, and the other dentist, I might be going to you. And that's actually happened for some of our practices which use our software, where they're like, oh, no, wait, let me show you. Okay, this is what the software is saying, and then saying, oh, okay, now I get it. So I think there is, as more tools are used in these practices, like the intro cameras, etc., which can show patients, here's a fracture, like Overjet, showing the patients, here's decay and what it looks like, here's bone loss, here's periapical radiolucencies, here's defective margin, what I'm talking about, then patient can understand that better and better trust. I would say the trust is also between the provider and payer. The same trust issues, the providers don't trust the payers, and the payers feel that dentists there's so much variation, and I think Overjet is the trust layer there as well. So we do think that Overjet is the trust layer for dentistry and help in better trust between providers, payers, and patients.
And the payers being the insurance companies.
Yes. Yeah.
Okay. Interesting. So is the system designed to be shown to patients? Like, have you ever thought of, I mean, this is me completely out of line, tell me if I'm out of line, giving you recommendations, but like giving a patient sort of an app that they could look and annotate their own radiographs, and it sort of an iPhone app or an Android app or whatever, and they can actually see their own radiographs on their own time on their own phone. Like, is that a possibility? Like, is there a patient interface?
Yeah. Right now, there is they can see it in their, it can be sent to their phone, and they can see their own x-rays with the markups, etc.
Okay, so it currently exists where a patient goes into the dentist and they can actually see, is it the annotated version of the radiograph or just the radiograph itself?
So it depends on the dentist how they want to share that data with the patient. But you can export the data from and send it to the patient. We don't have an app currently, but there are in the future developments that will happen for just the patient as well. But currently they can send an annotated annotated X-ray to the patient for them to better understand the diagnosis that was provided to them.
Interesting. So this next question could be interpreted as a technical question, but I'd encourage you to remember the potato analogy and just dumb it down to my level. So how do you differentiate, or how does the algorithm differentiate between what is, burnout, for example, and what's a carious lesion? Like, how do you draw that line?
Yeah.
Because clinically, it's even hard to do.
No, so I think exactly in this case, it is, if it is clinically hard to do, it is, it is hard for AI as well. And why is because it is learned from clinicians. Now, the interesting thing is sometimes things don't get treated and it gets bigger and bigger. And the good thing is we have access to that data too. So the advantage we have is we can look at historical information and see how, if say it was a decay, and the dentist for some reason thought it was burnout, and it grew much more, where it became very obvious, we would see it in the x-rays. Or the other way around, it was burnout and the dentist went and treated it. You never know, right? Like, so it could have gone either way, but we have that historical information that we can utilize. But in this case, I would say is like, the way to answer your question is that the way you train it is by showing it multiple, like many examples of what does a carious lesion look like and what does burnout look like. And the next time it sees burnout, which is like obvious burnout, it knows. Or now it's like when it's not that obvious, then it might predict either or, depending, and give probability to it. And most likely it is something that, again, it has seen enough that it is good at. I would say there's also another thing where when dentists look at an X-ray, they're looking at one contrast level or one brightness, and then they have to manually change that to see it across to understand that better. When we've trained our models across different brightness levels, different contrasts, etc., so it has a better. So even if it's like not looking that well, AI can do a pretty good job at it, because it looked at images in different formats, and it knows it's like the same image if you make it very, very bright as well, or change the contrast.
So this might be opening up a whole new can of worms, but you mentioned insurance and payers. So how does it work, just from the perspective of someone who may not be familiar, like myself, with how the back end of insurance works? Correct me if I'm wrong, but is it, say I'm the dentist, I say I've done an MOD on the 3/6 and I send that to the insurance. Is it someone physically sitting, on the insurance end approving this, or is this also AI on that front too?
Yeah, so right now, if they're not using Overjet, they're manually doing it. So there's a dentist reviewer sitting on the other side, looking at it, and made worse by the fact that dentists don't use diagnostic codes. So they're literally looking at the X-ray and making this determination and saying, okay, does this treatment make sense or not? And at least in the US now, we're working with some Canadian companies as well. We're working with majority of the top carriers or top insurance companies in the US, where they use Overjet software to make that determination now. And why that's helpful is that it's accurate. It is consistent. So every time it's the same determination rather than getting different determinations, and it's quantitative. So it's not, where, for example, you can have a threshold that anything above 3 millimeters of bone loss will be considered, or bone level will be considered bone loss, and scaling root planing will be the medically necessary treatment there. Now, you can actually measure it, make that measurement on every tooth in that patient and determine how many teeth satisfy that criteria and do it very accurately. So in the alternative case, when dentists are reviewing it, one dentist might think there is bone loss, the other might think there's no bone loss. And say you got a reviewer which thinks there's no bone loss, you're going to get the claim rejected. Now you're going to appeal, and it's going to go back. The other dentist is going to review it. They might accept it, but now you wasted time. They've wasted time and money, and in the end, the outcome is the same. So, having more consistent quantitative outputs really allows for better decision making in dentistry and more objective decision making in dentistry.
So this is information to me. So the insurance companies pay a dentist to sit on their back end and ensure that the treatment that you're doing is actually clinically sound.
Yes.
And so just to reiterate what you said, your value is, okay, don't use the dentist, use Overjet on your end, so you can actually tell if these two things align. And if both the dentist and the insurer are using Overjet, then of course they're going to align.
Yeah, so one is that, but I would say right now Overjet does not deny claims, we accept claims. So payers are using Overjet to accept the claims, and then if there's any chance of denial, they're still using human review to deny the claim, but most claims get accepted, right? Like, most claims that somebody's sending in get accepted, and it's very few claims that get denied. So but the good thing is now you don't need humans sitting through accepting all these claims and reviewing them. You can have an AI software do it much more accurately and consistently and faster, and you can get claims paid out faster, right? There is a delay in claims as well because a lot of this manual processing needs to take place.
Are you familiar with the levels of fraud in the insurance companies? Is that public information?
The fraud in insurance companies, or fraud coming from providers?
Coming from providers to insurance companies.
So,
the insurance companies are not fraud.
Yeah, I was like, wow, that's a big claim here. So
yeah, exactly.
According to the National Healthcare Anti-Fraud Association, it's about 5 to 7% of claims are fraudulent. We think it's a little that seems a little high to us. But there is in Medicaid in the US, we've seen more fraud happen. But I would say it's very few people doing it, but they're doing it a lot. So the numbers might appear because of that, but it's literally finding needles in a haystack. It's that rare, but when they're doing it, it's 40% of the claims don't make any sense. They might be photoshopped. They might be, it might be the same patient's data repeated again and again. So there's a lot to be done there.
Wonderful. Well, this was fantastic. I can't believe I got the opportunity to ask you all my dumb questions. It was probably taxing for you to answer some of them, but I appreciate you coming on the show.
No, thank you so much, Akhil.